I'm Dr. Steve Teitelbaum, and you're watching the Plastic Surgery Channel.
Hi, I'm Dr. Bill Adams, Chief Medical Officer of the Plastic Surgery Channel, and welcome to PSC Hot Bites, our newest program where the channel's experts provide you with timely assessment of hot plastic surgery procedures, topics, or technology, allowing you to cut through the hype, the spin, and misinformation that often plagues patients wanting to get the real story about plastic surgery. Joining me today via webcam from Indianapolis, Indiana, is Dr. Bruce Van Natta. Bruce, great to have you on with us.
Great to be on, Bill.
Well, let's switch gears for a minute. Women who can come in after having children often feel like their breasts have deflated, less fullness in the upper part of the breast. How does a patient know if she needs to have a breast implant or a breast lift or a combination?
Well, that can be obviously a tough question and one that's very individual, Bill. In fact, I can't always tell in talking to someone what they're going to need, and it really comes down to the exam. And I think also it's important to realize that individual patient factors of the tissues are going to play into this. Sometimes a little bit of deflation, which most women get after having a baby. They lose that upper pole fullness and they just want to see that fill up a little bit. Typically, an implant will help with that. But the question is, has the skin envelope stretched to a point that we need to do something about that? What I've found here in the last few years, I'm being much more aggressive doing smaller lifting procedures, such as a nipple lift, where we take the nipple areola and just do a crescent excision and pull that up, and maybe do a little tuck of the skin underneath to tighten that. And if I'm able to do those two things, in many cases, we can put in an implant to fill up that loose skin, and that solves the problem. I think maybe a good way for a lady to assess this, though, is if she finds that the nipple has settled to the fold or a little below. Certainly when it's below that, in most of those cases, she's going to need a more aggressive skin tightening procedure, perhaps in conjunction with an implant.
Well, that's great information, Bruce, and we really thank you for taking the time out of your busy day to talk with us today, and we hope you enjoyed this segment of PSC Hot Bites, and be sure to get your next bite on our website, www.theplasticsurgerychannel.com, and until then, we'll see you soon.
I'm Dr. Steve Teitelbaum, and you're watching the Plastic Surgery Channel.